Hi, my name is Stacy Schoaf, and this is an educational infomercial that will be focused on Vicodin, which is a type of narcotic. Now, you may be wondering what exactly are narcotics. Narcotics are also commonly referred to as opioids, and opioids or narcotics are those of naturally occurring substances that are derived from the opium poppy and whatever their synthetic substitute may be. Since Vicodin is one of the most commonly used narcotics in the United States, that's what we will be focusing on in today's infomercial. So now that you know the general term of what narcotics are and what opioids are, let's focus in on what exactly Vicodin is. So Vicodin is a combination of acetaminophen and hydrocodone. Acetaminophen is known as a less effective pain reliever that helps increase the effects of hydrocodone. Now, hydrocodone is a part of a group of drugs called opioid pain relievers, which is also known as narcotics. Now, just to give a little background on Vicodin abuse and the significance it has in the United States. In 2013, according to the Drug Enforcement Association, nearly 136 million prescriptions of opioid medication were dispensed, with Vicodin being one of the most common. On average, nearly 5 million people over the age of 12 abuse Vicodin in the United States, making this a very high concern and one that is starting at a very young age. Now moving on to some of the dangers that people who abuse Vicodin may face. Vicodin is known to be one of the most commonly used and abused painkillers. It tends to be frequently abused because it is widely prescribed for various common conditions such as toothaches, back pain, post-surgical procedures, or even chronic pain, all of which are very common conditions that nearly everyone faces at some point in time. Vicodin can be easily accessible since it has become more affordable and is offered in cheaper generic brands that people can be prescribed. Many of those who are prescribed Vicodin feel as if they aren't receiving the amount of pain relief that they desired or expected from the medication. This is often what leads them to unknowingly begin to overuse the drug to seek that pain relief that they're looking for, which often leads to addiction and dependence later on. Now on to some specific dangers that college students may face when abusing Vicodin. Students turn to these drugs oftentimes as a way to relieve the stressors of college. However, these drugs can end up leaving damaging effects academically, socially, and physically. According to SAMHSA, 1 in every 4 college students has illegally used a prescription drug. The biggest danger directed specifically at college students is when alcohol becomes involved. When opioids such as Vicodin become mixed with alcohol, the central nervous system becomes fully depressed and slows the user's breathing. Many accidental drug deaths are caused from these combinations. Because when 2 drugs have the same effect on the body, such as alcohol and Vicodin being both depressants, it doubles the negative effect and when combined can lead to potentially fatal physical effects. Now some signs of addiction to be on the lookout for yourself and for others. Someone who's using Vicodin may experience a tolerance or have their body become adapted to the effects of Vicodin when using as prescribed. That person who's taking the Vicodin as prescribed will have no other choice but to end up taking a higher dose than usual in order to relieve the pain and seek out the pain relief that they're looking for. Therefore, this often leads to needing larger doses than needed to relieve their pain, which usually is one of the first signs of Vicodin dependence and addiction. There are other warning signs to acknowledge, such as when someone is only getting pain relief from an unusually high dose of Vicodin, taking excessive amounts beyond control, withdrawal symptoms, which we will touch on in a little bit, using for recreational purposes and or mixing with alcohol, and one of the more obvious warning signs is for someone who is using Vicodin without a proper prescription for themselves to use the drug. Some of the more common withdrawal symptoms are known as cold shakes, chills and sweating, fever-like symptoms, mood swings, anxiety and depression, bone pain, vomiting, insomnia, and diarrhea. However, there are ways to get help and to receive treatment. Like most drug concerns, the best treatment is to seek out some type of detox program, and this will help remove the drug completely from their system. Another option may be to become involved in intensive therapy, and this is through long periods of therapy where the student or abuser will be able to explore the issues that ultimately led them to their dependency and will discover alternative ways to handle those different issues. Now, in case there still are some things that are unclear, let's touch on some of the more common myths around the topic of Vicodin. For example, opioids help ease long-term chronic pain, when in actuality, 90% of chronic pain patients end up on opioids but do not always relieve the pain. Another being opioids are not addictive when used to treat pain, when in actuality, 5 to 25% become addicted from their prescriptions from their doctor, and 60% of overdoses occur from these prescriptions. And that concludes the educational infomercial based on Vicodin. Thank you.